Hello, in this video we will discuss why the pleural effusion in heart failure more common on the right side. Introduction. I'm a Japanese cardiologist. In this channel, I will tell you about medicine from the basics. Sorry, but I'm not good at English, and please know that this is the content of medical treatment in Japan. Ushi-Sensei is Japanese, and it means cow doctor in English. Please subscribe my channel. Heart failure is defined as a clinical syndrome consists of dyspnea, malaise, swelling, and decreased exercise capacity due to the loss of compensation for cardiac pumping function due to structural and functional abnormalities of the heart. It is important to note that heart failure is a syndrome, not a disease. When treating patients with heart failure, it is important to distinguish the causes of heart failure and the precipitating factors. This is a diagram of blood circulation that I created. Blood circulates through superior and inferior vena cava, right atrium, right ventricle, pulmonary artery, lung, pulmonary vein, left atrium, mitral valve, left ventricle, aortic valve, aorta, and whole body. If the right ventricle is affected, systemic edema may occur. This is the right cardiac or heart failure sign. If the left ventricle is affected, dyspnea or shortness of breath may occur. This is the left cardiac failure sign due to the systemic congestion and interventricular interactions. Signs of both cardiac failure appear in the chronic phase, but it is important to separate the left cardiac failure signs from the right cardiac failure sign. Pleural effusion is the left and right cardiac failure sign, and the side is the right cardiac failure signs. Pleural effusion is a fluid accumulation in the thorax. Pleural effusion results in poor lung expansion in inspiration. This is fluid accumulation around the lungs, but the lungs themselves are not very moist. On the other hand, pulmonary edema is wet in the lungs themselves. Both arise from left cardiac failure, but the two situations are distinctly different. For example, assume that the bucket is the thorax and the sponge is the lung. Pleural effusion resembles a sponge floating in a bucket of water. On the other hand, pulmonary edema is similar to the sponge itself being wet. There is no water in the bucket, and if there is, it is little. Heart failure in the left side induced left atrial pressure elevation and pulmonary artery wedge pressure (PAWP) elevation. Chronic elevation of PAWP causes pleural effusion. Patients with acute heart failure with a sudden increase in left atrial pressure rarely have pleural effusion, even if acute onset. Chronic left ventricular dysfunction and chronically elevated left atrial pressure can be associated with pleural effusion. Then why is pleural effusion in heart failure more common on the right side? No clear reason seems to be known, but I will tell you the reasons as far as I have been able to find out. One reason is that the heart is on the left side. This situation causes that the right lung is larger than left lung in volume and the right lung has more seepage than left one. And another reason is that lymphatic drainage is more effective on the left side than on the right side. The lymphatic vessels are thought to be thicker on the left side than on the right side. Since the heart is on the left side, it is possible that lymphatic fluid flow is more developed in the lymphatic vessels on the left side due to the beating of the heart. So, even if pleural effusion accumulates bilaterally, the left pleural effusion drains more spontaneously than the right effusion. Therefore, in patients in heart failure, pleural effusion is more common on the right side. In my experience, in patients with heart failure, pleural effusion is often found bilaterally. The right side often has more pleural effusion than the left side, such as this image. I often experience unilateral pleural effusion on the right side only, but unilateral pleural effusion on the left side only is rare. In that case, we should list diseases other than heart failure, such as lung cancer, inflammatory pleural effusion, or tuberculous pleural effusion. In summary, pleural effusion in heart failure patients are more common on the right side. If you see a left unilateral pleural effusion, you should list other differential diagnostics besides heart failure. Thank you for your visiting and watching my movie. See you.